Words to remember. Chapter 8 Skin Disorders and Diseases. Flashcards. Review over and over for best results. Subscribe to my channel so that I can share advanced information with you. Lesion. A mark on the skin may indicate an injury or damage that changes the structure of tissues or organs. Bulla. Plural, bulli. A large blister containing a watery fluid, similar to a vesicle, but larger. Primary lesions. Lesions that are a different color than the color of the skin, and/or lesions that are raised above the surface of the skin. Tubercle. Abnormal, rounded, solid lump above, within, or under the skin, larger than a papule. Cyst. Closed, abnormally developed sac that contains fluid, pus, semi-fluid, or morbid matter above or below the skin. Nodule. A solid bump larger than 0.4 inches, 1 centimeter, that can be easily felt. Macule. Plural, maculae, maculae. Flat spot or discoloration on the skin, such as a freckle or a red spot left after a pimple has healed. Tumor. An abnormal mass varying in size, shape, and color. Vesicle. Small blister or sac containing clear fluid, lying within or just beneath the epidermis. Wheal. Itchy, swollen lesion that lasts only a few hours, caused by a blow or scratch, the bite of an insect, urticaria, skin allergy, or the sting of a nettle. Examples include hives and mosquito bites. Crust. Dead cells that form over a wound or blemish while it is healing, an accumulation of sebum and pus, sometimes mixed with epidermal material. Secondary skin lesions. Characterized by piles of material on the skin surface, such as a crust or scab, or depressions in the skin surface, such as an ulcer. Excoriation. Skin sore or abrasion produced by scratching or scraping. Fissure. A crack in the skin that penetrates the dermis. Examples are severely cracked and/or chapped hands or lips. Scale. Any thin, dry, or oily plate of epidermal flakes. An example is abnormal or excessive dandruff. Keloid. Thick scar resulting from excessive growth of fibrous tissue. Scar. Also known as cicatrix, a lightly raised mark on the skin formed after an injury or lesion of the skin has healed. Cicatrix. Lightly raised mark on the skin formed after an injury or lesion of the skin has healed. Acne. A skin disorder characterized by chronic inflammation of the sebaceous glands from retained secretions and bacteria known as Propionibacterium acnes, P. Acnes, the scientific term for acne bacteria. Milia. Benign, keratin-filled cysts that can appear just under the epidermis and have no visible opening. Ulcer. Open lesion on the skin or mucous membrane of the body, accompanied by pus and loss of skin depth and possibly weeping fluids or pus. Sebaceous cyst. A large, protruding pocket-like lesion filled with sebum. Sebaceous cysts are frequently seen on the scalp and the back and may be surgically removed by a dermatologist. Seborrheic dermatitis. Skin condition caused by an inflammation of the sebaceous glands. It is often characterized by redness, dry or oily scaling, crusting, and/or itchiness. Telangiectasis. Distended or dilated surface blood vessels. Rosacea. Chronic condition that appears primarily on the cheeks and nose, and is characterized by flushing, redness, telangiectasis, distended or dilated surface blood vessels, and, in some cases, the formation of papules and pustules. Anhidrosis. Deficiency in perspiration or the inability to sweat, often a result of damage to autonomic nerves. Bromhidrosis. Foul-smelling perspiration, usually noticeable in the armpits or on the feet, which is generally caused by bacteria. Miliaria rubra. Also known as prickly heat, an acute inflammatory disorder of the sweat glands, characterized by the eruption of small, red vesicles and accompanied by burning, itching skin. Conjunctivitis. Also known as pink eye, infection of the eye, that may be caused by a bacteria or a virus, generally extremely contagious. Hyperhidrosis. Excessive sweating, caused by heat or general body weakness. Eczema. An inflammatory, uncomfortable, and often chronic disease of the skin, characterized by moderate to severe inflammation, scaling, and sometimes severe itching. Dermatitis. Inflammatory condition of the skin. Impetigo. Contagious bacterial skin infection characterized by weeping lesions, usually caused by a Staphylococcus bacteria. Herpes simplex, a recurring viral infection that often presents as a fever, blister, or cold sore. Dyschromia. Abnormal colorations of the skin that accompany skin disorders and are symptoms of many systemic disorders. Psoriasis. Skin disease characterized by red patches covered with silver-white scales, usually found on the scalp, elbows, knees, chest, and lower back. It is rarely found on the face. Hyperpigmentation. Darker than normal pigmentation, appearing as dark splotches. Hypopigmentation. Absence of pigment, resulting in light or white splotches. CHLOASMA. Also known as mask of pregnancy, condition characterized by typically brown hyperpigmentation, generally on the face, which is not elevated. Albinism. Congenital hypopigmentation, or absence of melanin pigment of the body, including the skin, hair, and eyes. Leukoderma. Skin disorder characterized by light, abnormal patches, hypopigmentation, caused by a burn, scar, inflammation, or congenital disease that destroys the pigment-producing cells. Nevus. Also known as birthmark, a small or large malformation of the skin due to abnormal pigmentation or dilated capillaries. Lentiginous. Singular, lentigo. Technical term for freckles, small yellow-colored to brown-colored spots on skin exposed to sunlight and air. 10. Change in pigmentation of skin caused by exposure to the sun or ultraviolet light. Stain. Abnormal brown-colored or wine-colored skin discoloration with a circular and or irregular shape. Hypertrophy. Abnormal growth of the skin. Vitiligo. Hereditary condition that causes hypopigmented spots and splotches on the skin that often appear milky white. Keratoma. Acquired, superficial, thickened patch of epidermis. A callus is a keratoma caused by continued, repeated pressure or friction on any part of the skin, especially the hands and feet. Mole. Small brownish spot or blemish on the skin, ranging in color from pale tan to brown or bluish black. Verruca. Also known as wart, hypertrophy of the papillae and epidermis. Skin tag. A small brown-colored or flesh-colored outgrowth of the skin. Squamous cell carcinoma. Type of skin cancer more serious than basal cell carcinoma, often characterized by scaly red papules or nodules. Basal cell carcinoma. Most common and least severe type of skin cancer, often characterized by light or pearly nodules. Retention hyperkeratosis. The hereditary tendency for acne-prone skin to retain dead cells in the follicle, forming an obstruction that clogs follicles and exacerbates inflammatory acne lesions such as papules and pustules. Malignant melanoma. Most serious form of skin cancer, often characterized by black or dark brown patches on the skin that may appear uneven in texture, jagged, or raised. Anaerobic. Cannot survive in the presence of oxygen. Non-comedogenic. Product that has been designed and proven not to clog the follicles. Extrinsic factors. Primarily environmental factors that contribute to aging and the appearance of aging. Intrinsic factors. Skin aging factors over which we have little control. Contact dermatitis. An inflammation of the skin caused by having contact with certain chemicals or substances. Many of these substances are used in cosmetology. Allergic contact dermatitis. Abbreviated ACD, an allergy to an ingredient or a chemical, usually caused by repeated skin contact with the chemical. Free radicals. Unstable molecules that cause biochemical aging, especially wrinkling and sagging of the skin. Irritant contact dermatitis. abbreviated ICD. Occurs when irritating substances temporarily damage the epidermis. Sensitization. Allergic reaction created by repeated exposure to a chemical or a substance. Thank you. Next chapter. 9 Nail structure and growth. Click the subscribe button.